Hi, Iqbal. Welcome.
Hey, Patrick. Thanks for having me. It's a pleasure to be here.
This is great. Happy to have you. And maybe just before we start, Eleanor mentioned a couple of great resources that we have at Nurse Recruitment Experts. I want to add that just this week, we posted our new Nurse Retention Report 2023. We surveyed for this report 2,000 nurses to find out what they want and what keeps them in their workplace. Retention, of course, being so important these days. And the report highlights the importance of interpersonal relationships and the working environment as keys to employee retention. So if you do go back over to our website, you can go to the blog page and look for Nurse Retention Report 2023 on our blog page, and you can check all of that out. And I also want to mention that we host a Healthcare Recruitment Leaders Exchange for talent acquisition professionals in healthcare. And we hold monthly calls to network and discuss topics that are important to them. And our next call is next week, September 27th, and we're going to discuss how to support and develop your TA teams. And so the group is open to directors and higher level healthcare professionals. So if you're interested or a colleague is interested, sign up on our website. The link is in the chat and on the screen. And or send me a message on LinkedIn and we'll get you all set up. So hope to see you there. And we have about 65 people signed up for that already. We've had some really great conversations over the last few months since we got that started. So I want to share those with folks as well. So Iqbal, we talked over the last couple of weeks about an important topic, the trend that's happening that we're seeing in healthcare over the last year, 18 months, real increase in layoffs and reductions in force that keep popping up across healthcare. We've seen reports that show the trend continues in 2023. I see on LinkedIn a constant churn amongst talent acquisition and healthcare roles in particular. Among my LinkedIn contacts, people are moving, getting laid off, changing jobs constantly, constant churn happening. And I also noticed that several people who signed up for the webinar today, when I look at their LinkedIn profile, and I tried to connect with everyone if I could, I was surprised how many people, their profile picture says they're open to work, or they've just changed jobs, or they're posting that they're looking for another job. So clearly it's affecting people. Obviously, people are being losing their jobs, are really needing to see they're seeing the writing on the wall and feel a need to change. So I guess I want to acknowledge those people first, say we see you, wishing you the best and hope you find support and well as the success as you seek a new career opportunity. So I want to acknowledge those folks first. Are you seeing that as well, Iqbal, among your network?
Oh, 100%. And, when you talk about it the way that you are, I'm just reminded over and over again, 20 years ago, a term was used called VUCA, right? Volatility, uncertainty, complex, and ambiguous. And the pace of the change and the ambiguity continues to accelerate. And, quite honestly, this year has been nothing short of exceptional. In contrast to the last 5 or 10 years. You're seeing a lot of different factors that are impacting healthcare, from startups that are seeing venture capitalists and investments start to dry up. You're seeing technology take on a brand new role within different stratus of large organizations. And you're seeing this disparity really between healthcare professionals and talent acquisition professionals and the value that they have for the work that they do. So you're seeing all of these factors that are culminating in these different markers where we're talking about what stability should be or what it looks like today, and how professionals and executives are preparing themselves for what lies ahead literally around the corner within a week or so. So I'm seeing a lot of my colleagues and a lot of people in my network that have, within the last maybe 2 or 3 months, I've seen the green circle pop up on LinkedIn. I have seen requests for support about helping them network more. And this is an ongoing trend that, to be very honest with you, I do not believe that Q4 will be any different.
Eleanor mentioned your podcast. You've got a great podcast and a great following. I'm going to put that link up in the chat now as well. And are you hearing that when you're speaking with your podcast guests or others that you're linking with in researching podcasts? Are you seeing this impacting those folks as well?
So that's a great question, Patrick. I'll tell you that the guests that come on my show are, really at the head of a variety of different projects and initiatives that are leading their organizations down new roads. What I will tell you is that while they themselves haven't necessarily alluded to or spoken about some of the internal shifts that may be coming, their network and their colleagues do reach out to me, right? So we do see people that are within the digital health startup space or within established organizations like pharmacies, whether they are community or hospital or specialty pharmacies, and especially like hospitals and clinics where colleagues of theirs are seeing the opportunity to be able to express some ideas that they're seeing at their space. So not directly from the guests, and I can understand why, right? Like they have a mission to achieve, and their expertise is being leveraged to help that. But I see a lot of people that are commenting after the show to talk about what they're experiencing in terms of maybe misalignment, and then also like how that misalignment is starting to forebode what the next phase of the company will be.
And you mentioned when we were promoting this on LinkedIn, you mentioned in one of your posts an interesting stat. Do you have that handy?
I do. And thanks for calling that back out, Patrick. I'm going to supplement that post that we're talking about right now. But there was a report that was studied that mentioned that in the first half of this year, there were over 33,000 layoffs across the healthcare industry, right? So we are not just talking hospitals and health systems. We are talking within retail or community clinics, pharmacies, veterinary, as well as administrative and executive, and including insurance, health insurance as well. Like 33,000 is a huge number. And what's fascinating to me, like literally, if you go to my LinkedIn profile now, just yesterday or the day before, there was an acquisition announcement that was made where an entire Southeast regional pharmacy chain is not just selling themselves to a new competitor or a new market entrant, but they are literally divesting their entire pharmacy business. So 545 of Winn-Dixie stores across Florida, Georgia, Alabama, as well as will be impacting pharmacists, pharmacy technicians, managers, executives. I mean, the pace of this change is just dramatic. And so, there's still a lot more that's up and coming. And I think this may or may not be directly related, but it's certainly pause for reflection. Today, Bank of America announced that they are going to be increasing their minimum wage to about $23 an hour. And while you might be thinking within healthcare, that's really not that tangential. First and foremost, everybody within the banking industry is going to probably have to fall in line. But that will ultimately impact healthcare, both either directly or indirectly in terms of investments, as well as how they are going to be competing for those types of workers or similar entry-level workers that would want to be hired for healthcare work. It's just a fascinating time. And a lot of things to brace for.
Lots happening, and it sounds like a lot's coming. I can just think of a couple examples in the last week or so, speaking to folks that, a neighboring hospital had just completely shut down, and they were seeing it as an opportunity to try and recruit some of those nurses. But wow, what an impact on that team when an entire hospital closes. And others where there's a merger and those nurses are not looking to, they're looking to change because they're not necessarily wanting to stay with the new company. So massive changes and, as I say, churn and shifts happening all over the place. So, I mean, obviously—
if I can add one thing just to that, right? Like, I think that a lot of the times in the conversations I have, particularly with the nursing professionals, like there's this understanding or some sort of safety, idea that, listen, nursing is always going to be in need. And it absolutely is. But there's this misconception that nursing layoffs don't happen. And I don't mean just at the executive level or the leadership level. There are hospitals that do close that end up actually, start doing RIFs. So, for example, earlier this year, Ascension closed one of its Florida facilities because they decided to end their maternity care, and that impacted 62 registered nurses. Further down the road, like maybe 3 months later, McLaren closed one of its facilities in Ohio, and that laid off 245 nurses. Now, there is a very high likelihood that they were picked up, very, very quickly, right? But I think what's really fascinating to me is that, when you combine those types of layoffs with, some of the factors that are precipitating the shortage that is facing the nursing industry, it's really important that, professionals, executives, and even talent acquisition professionals that are looking to hire them are working round the clock
Yeah.
to come up with innovative ways to get them in the pipeline quick and build that relationship for the long term.
Yeah, let's talk about that. And before I forget, I'll just remind people, feel free if you have comments, questions, put those in the chat. If you're seeing cuts or reductions in force in your organization or among your colleagues, let us know what you're seeing and how this is impacting you as well. But yeah, and personally, I don't talk to that many frontline healthcare providers. Certainly our team does, so they're speaking to nurses and others all the time. But the people that I'm talking to who are mainly in talent acquisition, HR, and management, they're just demonstrating and describing what you just described, that all of these changes are having a massive impact on them. And in fact, that's one reason related to the topic that our group came up with, the Healthcare Leaders Exchange, for our next call, which is about how to support your TA team in a challenging time when there's so much pressure. And the person who brought this idea up was saying that, the expectations are so high, the demands are so high, resources aren't necessarily increasing for TA. I know I've seen in the last 18 months or so TA budgets being cut. So many organizations say we're desperate for nurses, for example, and others, but desperate for nurses, we've got to bring down travel expense, but at the same time, they've cut our TA budget. We don't have talent acquisition budget to do anything more. We're expected to do it all in-house. So let's talk about the TA teams a little bit more. Like, what else are you hearing from? And I know you were just at the National Association of Healthcare Recruitment conference, and I was going to talk about that at the end if you could profile that organization. But maybe what are you hearing about how TA folks are being affected by this?
Yeah, and it's really a great question, because I find that, if I'm talking to a a specialty, or if I'm talking to talent acquisition professionals that are more like, government-based versus not private corporation, like they're really like two dichotomous worlds. Right now, for example, many of my colleagues that are in the talent acquisition space supporting Veterans Affairs, they are seeing larger investments. They are getting more funding. They're having higher headcounts because there is an increase in terms of support for them in that space. And by all means, hallelujah, leverage it and continue to use that and show the results so that you get more. On the other side of the coin, what I'm seeing is that, for talent acquisition professionals that are struggling to find nurses or pharmacy technicians or medical assistants, like, unfortunately, they're tapping the same limited talent pool, and the strategies that are being used are actually not necessarily resulting in either faster hires, more hires, and what they're struggling is trying to be able to prove value to the organizations. And it's a really, dangerous, it's a double-edged sword. Like you mentioned it earlier, like talent acquisition budgets are being slashed. I know for many years, the having a seat at the table was the call to action, and then talent acquisition teams got it. We got the seat at the table to be able to talk about ideas, programs, and initiatives and get buy-ins from C-suite level executives. And while we have been able to prove value, the pandemic truly changed a lot of things. So the expectations are much higher. Talent acquisition professionals are looking to be able to, get more from what they have been given. And what they're struggling with is that tapping the same talent pool, even using different strategies, is creating a rift between their hiring managers and executive buy-ins to be able to say, well, listen, it is much easier for us to hire a travel nurse, and it's faster. And so it may cost us more, and it's hurting us. But at the end of the day, patient care is primary. So we're going to end up having to just bite the bullet. And this is where, again, that double-edged sword exists, where talent acquisition professionals are working their hardest to be able to say, this is a very high cost investment for the organization. And it's not an intermediate solution or a long-term solution. We need to be able to come together and work on this. So when I talk to my talent acquisition colleagues, unfortunately, many of them have been let go, or they're struggling to be able to move their needles forward. I have a colleague of mine that literally just found a contractual role after 7 months of unemployment. And he is not, that is not uncommon now. Unfortunately, this was a pharma industry or pharma company representative from the TA side that he was let go of. But 7 months is a long time, and it's trying to come back into a role where the tools are changing, the technology is changing. Patrick, you mentioned just this a few moments ago. Companies are slashing budgets for training and and networking opportunities. I don't know what your experience has been, but so many of the clients that I've worked with in the past have invested heavily into new applicant tracking systems, CRMs, and then the integration with HRIS. But the training isn't there. The input that was put to be able to help carve out better processes on the recruitment side were never enacted. And so you're seeing all of these parameters that are slowing down the hiring process, that's turning off or declining candidate engagement, and just a variety of these factors. So yeah, it's my heart bleeds for the TA team. It really does. And it's a great conversation to have, which I'd love to hear some comments from the team to see what they're experiencing as well.
Yeah, so I did post a moment ago a couple of comments. So Alexandra said she's seen lots of cuts for budget purposes. I think when we were speaking about both TA and frontline nursing, and then someone from Behavioral Talent Consulting mentioned that she's seeing this in pediatric autism care as well. So definitely the cuts they're confirming what we're seeing as well. And, we talked too about when during COVID, so many nurses left. So many seasoned nurses left. And nowadays, when I talk to talent acquisition, a year or two ago, they were saying we need to have applicants with 6 months, a year, 2 years experience. And now they're saying, never mind, we'll take anybody, which is, they have to be open-minded. They have to try and get as many in the door as they can. But the challenge is we're also hearing, without those seasoned nurses there, the supervision, the mentoring, the support is not there. Yes. And then I worry about the nurses who are thrown into the supervisory roles and don't have the training that you talk about, the mentorship and the guidance as a supervisor as well.
Patrick, I've been very fortunate, right? I have a very large network of nurse supervisors, charge nurses, and nurse executives. And so I've had conversations, particularly in the last week and a half, to kind of have a better bird's eye view in terms of what they're experiencing, right? So I've talked to like a charge nurse in California. I've talked to a nursing shift supervisor in Florida. And, a lot of the mechanisms that exist within their industry and within their organization are disparate, which makes it, very fascinating to hear. So for example, in California, the hospital that this one individual nurse works at, they have pensions. And so their attrition rate has been marginally smaller as compared to the rest of the country because they're able to do that. And their seasoned nurses are still there. The challenge that they face in this space is exactly what you're saying, is that you have these new nurses that are coming out of nursing school that unfortunately, due to the pandemic, their rotations were modified or cut short. They do not have the hands-on experience to literally know how to administer medications through an NG tube or how to empty a Foley catheter. And so what is happening is that the impact of that on experienced nurses or established nurses are like, wait a minute, I already have 8 patients right now. So somehow in the middle of all this, I'm going to come and either A, try and teach you, or B, at some point, that break point is I'm just going to have to do this for you and then teach you on my lunch break. What's also fascinating is that some of these nurses that I've spoken with are saying that the travel nurses that are being brought in, they're not being properly vetted from a work experience, especially in specialty. So the example that I was given was that, she works in the ICU ward and she has had travel nurses that have come through that list that they have 6 months, 9 months, 2 years of ICU experience. And when they get there, they literally say, I don't know how to do this. And so, I think it's important that partly the pandemic, but partly with verification, I think that there's a lot more challenges that are coming on a day-to-day basis that nursing professionals have to try and overcome. And somehow our talent acquisition professionals that are working with agencies, particularly the leaders, I would love to know how that vetting process works and what assurances agencies are able to give to say, yep, we've done this.
Right. Wow, so many layers there. And then I think the pressure that this adds, thinking back to those TA folks, the pressure that all of this puts on them, right? Yes. As the pressures on the front line reflect back to talent acquisition. As I say, the ones who are told, fine nurses, but no budget to do it. And then I know, and we touched on this, but I know we've seen with cuts to TA, people leaving talent acquisition, people seeing the writing on the wall again and moving. Again, so many people moving to other industries. Suddenly
Yes.
they're no longer in healthcare after many, many years. So again, losing that knowledge, expertise, experience, opportunity to mentor new people is going out the door as well, right? So that's adding additional strains and pressures on those left behind.
Yeah, you know, from a talent acquisition perspective, I think I've seen like two trends that are increasing, right? One is exactly what you pointed out. You're seeing an exit of experienced recruiters in healthcare that are deciding that maybe this is just the right time, whether they've reached a certain age or a financial, level where they feel that this is something now, an opportunity to pivot and try something new, or they're just sort of like not adjusting to the new ways and the new processes. I've had conversations with professionals that says, listen, I don't really care for the tenacity and the mechanics of this new ATS, right? Like what happened to just like showing up to a career fair, shaking hands, exchanging business cards, and then building that relationship.
Right.
And I think it's interesting, especially for the TA leaders that I see, kind of commenting here or that have registered already. Like, I would love to hear some of the anecdotes of where those conversations have to take place, because these experienced recruiters that may or may not still be with this team have voiced their opinions, and we're trying to straddle these two worlds of high tech and high touch, and we want both. We absolutely want both, right? You have to be able to, build an audience on TikTok at the same time, build an audience at a university or a college at the same time, maneuver and manipulate and master these new ATSs. So yeah, there's a lot, I mean, in terms of demand. But what is also interesting, Patrick, which I saw both this year and last year at the National Association of Healthcare Recruitment's conference, we had a bumper crop of brand new healthcare recruiters. These are people that have found or discovered healthcare recruitment, and they, are leveraging some of their past roles, whether it was in sales or whether it was in recruitment or HR, and they're finding that this is a great opportunity, that they want to do this, but the mentorship doesn't exist, or it's not easily accessible. And that's where I think that's where, I look to my colleagues that have been doing this for 5, 10, 15 years. Like, who can we take under our wing? Like, who can we help and help, either educate, solve problems for, because, us helping them, and anyone that's ever been a mentor or leader understands this and recognizes, right? It's not about what we do for us or what we do for the organization, but in reality, it's like, how are we helping elevate the industry, and how are we making an impact on healthcare as a whole? So yeah, like trying to get out there and just say, listen, you have a problem, here's my LinkedIn profile, here's my card, my number, talk to
networking and supporting each other. Yeah. Well, before we move into maybe what some people are most interested in, the ideas for moving forward, if you're one of the people left behind after cuts in your organization, how to find inspiration and stay grounded. Let's, you talked a bit about the technology that's being used, and we had spoken before as well about whether AI has any play in what's happening here, artificial intelligence. Do you want to touch on that a little bit?
Yeah, I'm a big AI guy, right? And I don't mean that like in a sense that I'm like playing with, Leonardo or Midjourney or like ChatGPT 4 all day long. My wife would be really mad if I was ignoring her and, spending time with like all of these other AI tools. I think in our previous conversation, which I'll just kind of bring into this, right? And we had talked about, is there a conscious effort to implement and leverage AI at the expense of human power or of labor?
Right.
I don't think that that's necessarily the case. I think that, like most human beings and most organizations, I think that while we are all great at strategy, we're great at strategy when you're just looking at the here and now and you're projecting what the world will be like in 12 months or 24 months, or in some cases, if you have the luxury, 36 months. But with the advent of AI coming onto the public scene just January of this year, right? Like, we've all heard and seen any Google conference or Microsoft conference about what they're working on, but the tangency wasn't really there until people had access to ChatGPT and Bard and OpenAI. And then all of a sudden you're hearing, students that are like leveraging it for their own college papers and opening up a panacea of new entities.
Suddenly it's real.
Yes, suddenly it's real, right? And so now healthcare organizations weren't thinking about like, oh, well, we're going to be able to leverage, those tools. Like they were like, how do we implement chatbots and how do we create algorithms that will help in the candidate engagement process and the candidate experience? Now, as we are facing this perfect storm, right? Like talent acquisition, attrition, healthcare professional attrition. I see Alexandra posted something in the comment section that I will agree with 100%. You see many patient-facing providers that have hit their max, hit their limit, or have just decided that this is not where they want to be and are leaving healthcare entirely or leaving the patient-facing provider role. But healthcare organizations are being forced to consider alternatives and consider what are we able to implement, leverage, or acquire in order to be able to sustain our business and our business model. Right. And I think that AI is offering it's probably low-hanging fruit, in my opinion. I think that you will need to have some time and some experts that can be brought into the organization to talk about where, certain AI tools. I mean, I'm seeing a lot of conversation now about Excel is dead and this new AI tool is going to replace data analytics completely and going to be able to create these new dashboards. I mean, I would be surprised if, a listener today isn't like Googling that right now to figure out how do I get data analytics at a faster clip and be able to showcase that to my executive partners in order to be able to get faster movement in the space. But yeah, AI it's not coming. It is here. And I do suspect that within the next 6 to 12 months, there will be some cataclysmic shifts coming in healthcare talent acquisition and in other areas of healthcare operations that are going to have to leverage AI in order to be able to do what they're doing today. It's not necessarily to make more profit or necessarily to be more efficient. It's just a matter of maintenance.
Yeah, right. Well, that's so interesting. Sounds like we might need to have you back for another focused conversation on that. So we should talk about that idea. Great. Okay, well, let's so on the topic again of the layoffs, the RIFs in healthcare, let's talk about what you wanted to really, I think what you really wanted to share was how people can move forward, whether you're a frontline healthcare provider, whether you're working in TA, HR management, you're one of the people left behind after a cut and the pressure's added, growing. How do people move forward? How do people find inspiration and keep going day to day?
Yeah, so I'm always reminded of there used to be this like book series called Left Behind about a decade ago. I'm showing my age here, but it was very fascinating. This was a post-rapture book for those of you that may be interested. But yeah, I mean, I think what's fascinating is that all the news, all the media headlines, all the conversations that take place are about what happens to those individuals that were let go or that are now, in the midst of this RIF. And there's very little support for those individuals that are fortunate to still be able to say, I'm still employed, I'm still working for a company that I respect, and I'm aligned with their values, but the demands are higher. Workloads have doubled. We've talked about investments being slashed, but expectations increasing as well. I think the first thing is, in reality, it starts at the individual level, is to know what's important, and it's important to know how to prioritize. Leaders, including myself and many of my colleagues, are being asked to do a lot, and they're asking their teams to do a lot. And so as an individual contributor, my recommendation is always to ensure that having open and transparent conversations with your direct supervisor to say, great, here is what I assume are my priorities for the week, the month, and I'm working on it diligently. There will be times where projects take precedence, and that's fine. I need to know what to be able to move down to level 2 or level 3, right? With your understanding in our conversation. And I think it's a hard, thing for some new recruiters and for some, established talent acquisition professionals to bring that consistently to the forefront. Yeah. And I would encourage people to make sure that they recognize and speak to the limited capacity that everyone has. We all hear do more with less, and that's fine. It's a great slogan. But in reality, you have 24 hours and you have a commitment to many things, including family or caregivers or as a child, children, elderly in my case, that you have a limited bandwidth. So shifting priorities, I think, has to become a skill set that everyone needs to become, adept at. And I think also from a talent acquisition manager or leader perspective, to be able to recognize like, where can I help my teams produce the highest results or the best results fastest, and what are things that we need to certainly offload. Like there are times where I will have conversations with talent acquisition professionals that are being brought into conversations about compensation, or they're being brought into conversations about, give me your feel from what candidates are expressing about our benefits offerings. And while those are valuable and they do have short-term, intermediate, long-term effects, I think that a lot of the times talent acquisition experts are being pulled in too many directions, and managers and directors need to stop and say, this is awesome, and I'm glad that you are tapped, but your first priority is this. And so I want you to be able to kind of shield those professionals. On a more personal basis, Patrick, being grounded is important. Like there are things that people have to do for themselves. I've heard this thing and I've shared it with many of my clients, like you cannot help others until you are in a good place yourself. Right. So if that includes a massage every month, or, like treating yourself to something as simple as an ice cream cone, do something for yourself that allows you to mentally and hopefully physically take a break from the environment that you're in. It's very easy to lose sight of the forest for the trees. You just get stuck with focusing on the 5 trees around you. But having the ability to pull yourself out of that environment, reset, and be grounded in that space. And the last thing I will tell you is, building a core group of supporters is essential, right? There are colleagues, hopefully on this call or on this meeting today, but certainly within other small groups, right? National Association of Health Care Recruitment is a prime example of where recruiters can touch and talk to other healthcare recruiters that are dealing with the same high expectations or the same challenges or the same technology troubles or the same lack of talent, limited talent pools. And we tend to operate in silos, right? Like this is me. All I have is this, and nobody understands the pain that I'm going through. By networking with like-minded individuals, whether that's local, specialty-based healthcare, organizations like NAHCR, I strongly recommend that. You will feel that it's both cathartic and educational, and quite honestly at the same time. So building a core group of supporters and networking within your profession will make a huge difference.
Yeah, that sure lines up with, again, what I've seen in the conversations of our Leaders Exchange. So just to talk to people who are in the same boat, right? The same situation, similar situation, at least in terms of impacts, pressures, cuts, and so on. Also sharing ideas, ways to move forward again, new ideas they haven't tried. I see the conversation blossom and people really take notes and move on with them. So that's really, and I know at least one of those people in that group was recently laid off. So but they still want to be a member of the group, as in terms of both the networking and the support and potential opportunity to find out for what new opportunities are coming down the road. So definitely networking, support, and whether that support's within your immediate workplace, within your larger organization, or within your own network outside of the workplace, right? That's absolutely critical.
Absolutely. Patrick, there's like one more thing I would add, right? Like, and this is something that I recommend to any professional or executive that's listening today, especially TA. Like we have a tendency of being able to talk about best practices for candidates, right? When a candidate goes through the application funnel, sometimes they're weeded out at the beginning because their resume doesn't align with the job description, or they'll get to the end. And we give them feedback, right? But I find it fascinating, unfortunately, and this is based on I'm throwing myself in here, is that we don't necessarily keep our resumes updated or our LinkedIn profiles optimized on a regular basis. And I don't mean every day, every week, every month. I'm just talking like twice a year.
Practice what you preach is what you're saying?
Practice what you preach. You hit this nail on the head for me, Patrick. If you're going to expect other people to come to your job or come to your company with the best version of you, you'd want to be able to do that with others, right? Because it's a two-way street. Healthcare executives that are focused so heavily on the projects and building teams and supporting them need to be able to talk about those achievements and accomplishments in a positive way and on a regular basis. But if you're not updating your LinkedIn profile more than like every 4 or 5 years, you will find yourself in a position where suddenly you're putting out another fire. That fire is, self-induced.
Right.
So I encourage everyone that's on this call today, or has friends or colleagues that are like, yeah, maybe I should just kind of go back and see what my LinkedIn profile says,
Right.
or update my resume with just a tidbit of updated information. I think
Right.
that would be helpful.
And even just for the sake, if you're like me, after a few years, it's so easy to forget what kind of projects, accomplishments you achieved in any given year or past years. So keeping it refreshed, it sounds like a really good idea.
Yeah.
On the networking pieces, and maybe that's a good time. You talked about networking. You talked about the National Association of Healthcare Recruitment. You are recently elected as president-elect of the association. Why don't we take a minute now to talk about that and what those networking opportunities look like? And you're clapping your hands and ready to go. I'll put the link on the screen too so people can find them, but tell us about NAHCR.
Sure, absolutely. So the National Association of Healthcare Recruitment has a vision to become the premier organization for healthcare recruitment, right? And that covers everything under the sun, from sourcing, HR data analytics within the TA space, to obviously recruiters, managers, directors, VPs of TA. And we support every discipline under the healthcare talent acquisition industry or banner, right? So hospitals, healthcare systems, pharmacies, veterinary clinics, home health agencies, long-term care facilities, even senior living facilities, and everything in between. And what I really appreciated about this organization is like the resources that are available and are being built to address current challenges is phenomenal. We offer a variety of different tools, and I talk about this, and I won't like bore your audience too much to death. But what I find fascinating is that the partnerships that NAHCR builds with both individual members as well as vendor partners it's a symbiotic relationship. So for example, when I talk about vendor partners, these are organizations and companies that have tools and technology where they're able to help TA teams either parse through resume, like mountains and mountains of hidden and visible data, to be able to talk about, hey, how is your recruitment process working? Recently, National Association of Healthcare Recruitment formed a partnership with PwC, PricewaterhouseCoopers, to be able to extend their data analytics services to our individual members. And so we are able to actually work with PwC and say, hey, if you are interested in understanding how your recruitment processes work, where the high points, the low points, the choke points are, by being a member, you will get a massively discounted rate to work with PwC. And these people are phenomenal powerhouses when it comes to that space. From an individual membership perspective, like again, that networking concept is reinforced on a monthly, quarterly, and an annual basis. So we do have multiple meetings. Some are virtual, some are in person. As you pointed out, Patrick, we just had our annual conference in July, which was in Austin.
Right.
Super hot, but it was hot and good. I will put it that way. Super hot and good.
Good stuff.
I'm sorry, go ahead.
I was going to say that's where we met, actually, Iqbal. It was at the NAHCR conference a little over a year ago in Minneapolis.
Yes,
also
and it was
hot
then too. I don't know if this is a trend or not, but the temperature outside was hot, but the education and the networking was hotter. So we had like this year we had over 200 members that attended, and we were able to really explore some new avenues, right? So many of the chokeholds or many of the challenges that TA teams face, we were able to talk about, how to capitalize on, foreign workers, and how, for example, one of our speakers talked about how family members of foreign professionals that are allowed to work, their family members are eligible to be employed for non-professional roles, which was, a light bulb moment for a lot of our attendees. And there were a lot of other ones as well. So we do all these conferences, webinars, we bring in experts, just like NRX is bringing, to the realm today. And we talk, with our vendor partners to do like case studies where their partnerships with other vendors have actually, or other companies have brought TA to a new level. one of the things that I'm working on as not just an executive board member, but also as a member myself, is getting certified through NAHCR. So we actually have a very high intensity certification program called the Certified Health Care Recruitment, or CHCR certification, that allows individual recruiters not only to learn the fine points of being an exemplary recruiter, but to be able to garner a certification. In fact, just last month, we had 20 new CHCR certified recruiters get certified. Very, to me, that is something that sets apart somebody that dabbles in the industry versus somebody that can come to another organization or leverage their strengths to talk about how to elevate their game and really bring strategy to the forefront. So lots of different fun things. And if you're interested, thank you again for posting the website to that. Feel free to check out the website or reach out to me or any of my colleagues. We would be more than happy to talk to you about that as well.
That's great. Hopefully you'll get some new contacts and signups from that as well. Awesome. Well, just to summarize our conversation and the key points about how to thrive through healthcare cuts and layoffs, you talked about leaders needing to be able to support their team, identify what priorities are and what we need to offload if there's something to offload, and really make sure we get focused on the priorities for our team, take some pressure off. Individuals need to know how to prioritize for themselves and also recognize their limited capacity. And of course, the importance of self-care, taking care of yourself so that you can support your team and others. And then the important point of building your own network of supporters, having a resource, again, whether it's within your organization or outside, so that you're supported through this. And then, of course, to practice what you preach, be ready, be thinking about your career, maybe not with a plan to change, but to be ready in case a change is imposed upon you. So that's some good advice. Anything else you'd like to add before we wrap up?
I mean, we've covered a lot, Patrick, and I've seen a lot of great posts from Behavioral Talent Consulting, from Alexandra. I don't feel like there's anything more that I can add except for reinforcing what you've just stated. I think, as we round up, we are literally 2 weeks away from the start of Q4, right? And I will not be surprised if there will be more announcements made in the coming months. And I just want people to not fall into drama. I think that's something that concerns me, is that sometimes people internalize notifications, and certainly it will happen to you or a colleague, and there's a probability that someone will be impacted. But working within what your strengths are and leveraging opportunities that you can either develop today for a short-term result or even intermediate is very, very wise. So that's what I would say is keep that in mind. No matter how things progress, stay grounded, leverage your network, build upon the strengths and the opportunities that you're able to develop or that you have available.
Right. Okay. Well, that's great. That's a good place to close, I think. I appreciate your advice and input, and I hope people will subscribe to your podcast, Healthcare and Hire podcast, reach out to you about National Association of Healthcare Recruitment as well. And again, feel free to check out our website, check out the blog page you'll find this webinar posted there soon and all of our other webinars from the past. And you'll also find the report that I mentioned that we just released yesterday or the day before, Nurse Retention Report 2023, where we surveyed 2,000 nurses on why they stay in the workplace. So that's on our blog as well. You can look for it there. And hopefully we'll see more people in our upcoming webinars as well down the road. We'll be announcing our next one soon. Thanks again, Iqbal, so much for this, and look forward to maybe having you on a future conversation on that AI topic or others as well down the road.
Thanks so much for the opportunity, Patrick. I appreciate it.
Thanks, everyone. Have a good week.
Bye-bye.